Hi, welcome to Endless Nurses World. I hope all are fine. In last video, we'll study about hypernatremia. In this video, we'll talk about hypernatremia. We'll see hypernatremia. Hypernatremia is a serum sodium level that exceeds 145 milliequivalent per liter or 145 millimole per liter. In what are the causes? There are four main causes. First one is decreased sodium excretion. Second, increased sodium intake. Then third, decreased water intake. Fourth one is increased water loss. First, decreased sodium excretion. Corticosteroids, Cushing syndrome, kidney disease, hyperaldosteronism. Kidneys plays a major role in regulating the acid-base balance and electrolyte balances. If there is any problems in the kidneys, leads to electrolyte imbalances will occur. Especially hypernatremia will happen. Second cause, increased sodium intake. We are taking excessive oral sodium and excessive administration of sodium containing IV fluids. Then decreased water intake, NPO status or fasting. Increased water loss, increased metabolism, fever, hyperventilation, infection, excessive diaphoresis, watery diarrhea, diabetes insipidus. And these are all the conditions. Water loss will be increased. What will happen? There is increased water loss leads to hyperosmolarity. In this osmolarity, the fluid moves out of the cells, so it leads to dehydration, cellular dehydration, and leads to hypernatremia. Then coming to assessment. In assessment, we will see the first one is cardiovascular. Heart rate and blood pressure respond to vascular volume status, either hypovolemic or normovolemic or hypovolemic. In respiratory, we have to see the pulmonary edema in case of hypervolemia status. Neuromuscular, there is early and late. In earlier we will see the spontaneous muscle twitches, irregular muscle contractions. In late symptoms, we will see skeletal muscle weakness, tape tendon reflexes diminished or absent. Central nervous system altered cerebral function is the most common manifestation of hypernatremia. In normovolemia or hypovolemia, we will see agitation, confusion and seizures. Hypervolemia will see lethargy, stupor and coma. Gastrointestinal, we will see the extreme thirst. Renal, decreased urinary output. Integumentary system, we will see the dry and fleshed skin, dry and sticky tongue and mucous membranes, presence or absence of edema depending on fluid volume changes. Laboratory findings, we will see the serum sodium level exceeds 145 milliequivalent per liter and increased urinary specific gravity. Interventions, first we have to monitor the cardiovascular, respiratory, neuromuscular, cerebral, renal and integumentary status we have to assess. Based on this causes, we have to treat the patients. If the patient is if the hypernatremia occurs due to fluid losses, we have to prepare and to administer intravenous fluid infusions. If the cause is inadequate renal excretion of sodium, we have to administer the diuretics that promote sodium loss, and we have to restrict sodium and fluid intake. So these are all about hypernatremia. If you like this channel, you can subscribe to me and ring the bell button. You will receive my notification. Thank you.